Perimenopause is when that cycle, which should be about every 28 days, either lengthens or shortens. And what happens really starting at age 35 is certain hormones begin to decline. There's a number of reasons for that. Environmental toxins, just the 21st century stressful living lifestyle is one of them. The first thing that happens is DHEA goes down. Now, DHEA doesn't have actually its own receptors. DHEA rises in the morning. We test it as DHEA sulfate. And DHEA is kind of like your Swiss Army knife of hormones. Oh, she needs more estrogen. Let's take it to the estrogen pathway. She needs more testosterone. Right? Let's go that way, right? And when DHEA goes down, the first thing people really notice is, I gain weight a little bit easier, and I just don't have as much energy. But really what happens, beginning at age 35 and more so from 35 to 45 is all the sex hormones go down. Estrogen, progesterone, testosterone primarily. They all decrease, but they don't decrease at the same rate. Progesterone will fall 35%. Estradiol might not fall at all, but testosterone falls an even greater amount. Okay? It may fall 75%. And it's a misconception that women don't need testosterone replacement. At any given time in a healthy woman's young life, 25 years old, when she has all of her hormones at the optimum levels, her testosterone level is 10 times what her estrogen level is.
Wow.
Okay. Now, a man will have 10 times the testosterone of a woman.
Yes.
But what are some of the signs and symptoms of perimenopause? Fatigue, losing bone mass, losing muscle mass, gaining fat mass, and testosterone is a crucial player. The mental fog also is a player. And some women will actually say they get migraines. And 80% of women have migraines go away if they're testosterone deficient and have their testosterone replaced.
Okay, that's interesting because I've been experiencing all of that. First of all, I've been experiencing migraines, which I've never had before. Since I got my first one around 5 years ago, and now they're more frequent. I would say once every 3 months, which is already one migraine is one too much. Horrible brain fog. I've also just tested my body fat. I did one of those like body fat scanning, and I'm like 7 or 8% above what I was, all through my late 20s, early 30s. And then the brain fog. And with someone like me, I have to do interviews. I run a school, and that has been the most frustrating for me. Like, okay, whatever body fat, I can work out more, I can eat better. Right. But the lack of like my cognitive being able to even say sentences that used to come out really easily. It's hard for me to finish them. And so what do you recommend? What's like the first thing a woman should do that's going through these symptoms?
In perimenopause, we have to first validate it, okay? But you have to have the right test, because if you can take one blood test, okay, at one particular day to measure all of your hormone levels, it doesn't give you the best picture of what's going on. There's a company called Genova Diagnostics. They have a kit that is an at-home test kit. You spit in tubes, so you take 13 samples over a 28-day period, and this charts for us when the hormones are going up and down. And there's something that occurs first called luteal phase defect, which means in the second 2 weeks of your cycle, when progesterone should be rising, that's the first thing that goes. You don't get that progesterone rise. We call that the luteal phase of the cycle. You don't have the progesterone level rise. It's much more difficult to conceive if that is your goal. So you solve luteal phase defect by dosing progesterone second 2 weeks. But what else comes with progesterone deficiency? Skin gets dry, lack of sleep, so you have insomnia. Those are a couple things. You must test the testosterone level. I'll point you to a video, if you can find it, and put it in the link. A good research colleague that I've worked with, a physician, actually a former breast cancer surgeon, Rebecca Glazer is her name. She runs wellness clinics in Ohio, and she did a lecture. The title is Testosterone Decline and Aging. And it was for both men and women, and it was to the European Menopause and Andropause Society, and it was because of both genders. And what do you typically do? Well, the first thing is I recommend get your hormone level assessed. You're going to find testosterone deficient. Let's start there. If I was a cynical pharmacist giving a presentation to doctors about the benefits of testosterone, or let's just say the signs of testosterone deficiency in women, I could point to 6 different drugs that we could prescribe. We got drugs for your migraines. We got drugs for your depression. We got drugs for your insomnia. We have all that. We've got drugs for your bone loss. There you go. There's 5 prescriptions. We got drugs for your anxiety. There we go. 5 prescription drugs. But you know what? I could resolve all of those symptoms by giving you a healthy, normal level of testosterone and exercising, because what you don't feel is testosterone also deficiency. Testosterone deficiency also leads to insulin resistance, and you become pre-diabetic, and then your insulin level comes up, so you're depositing and storing more fat. Start with testosterone. And I'll give you one more tip since you mentioned migraines.
Yeah.
Over 90% of women, if we work on two things, migraines go away. Most migraines, testosterone deficiency, replace testosterone to a healthy level. Okay, it works. A lot of other women, magnesium deficiency. Magnesium deficiency is horrible. In fact, 90% of Americans are not just deficient in magnesium, they're grossly deficient. This is a study done by Purdue Pharma, who actually manufactured a drug called Magox, magnesium oxide. Magnesium oxide doesn't work that well. And this is only according to the US RDA. The recommended daily allowances are actually pivotal to what the body really needs. I'd recommend a woman like you probably take in 600-700 milligrams of magnesium per day. And the magnesium that concentrates in the brain is a form called threonate. There's different forms of magnesium. Magnesium threonate gets into the brain. What does it do? It calms down excitotoxicity, and we get excitotoxins from the blue light screens, fake light, EMF exposure. So you need magnesium in the brain, and you develop migraines if your brain is deficient in magnesium. It also improves cognition. It improves memory, magnesium threonate. So that's a supplement form, and your number one food to get magnesium into your body is organic roasted pumpkin seeds. No other food comes close. I recommend everyone 4 ounces a day, organic roasted pumpkin seeds, have 500 milligrams of magnesium. I just recommended 700 milligrams for you. So there's your first 500. You don't have to take any capsules, but you still need to supplement. Men, I typically recommend 800 to 1,000, or if they're big guys and exercise a lot, every time they sweat, they're losing magnesium, maybe 1,200 milligrams a day. Combined intake of a quality supplement and things like pumpkin seeds, because the food that is in second place is almonds, and it only has 225 milligrams per 4 ounces. So organic pumpkin seeds are the way to go. And that's where I'd recommend you start: a hormone assessment, a couple of supplements to take care of some of the symptoms you described. And as a pharmacist, I don't prescribe, I make recommendations. And I make recommendations to people who ask me for a health consult like you, and also make recommendations to physicians who have wanted to train in functional medicine. Say, Robert, I know what you do. They're local in Las Vegas, and I have this case. Can you help me with this case? I give my communications directly to the doctor and say, look, this is what I've seen commonly prescribed. This is what I recommend. Try it, follow up. And 9 times out of 10, we get symptom improvement in people. And I just want everyone, you too, to feel a lot better.
Thank you so much. And if you are new to coming into the live, I am discussing some of my health issues that I've had that are very common. I have post-COVID right now. I'm experiencing perimenopause, and Dr. Robert is a pharmacist with the Wellness Company, which is one of the few organizations in this country that is speaking against all of the mandated vaccines and all of the and they're pro medical freedom. So it's an honor to be able to share this conversation, to have this conversation with you, Dr. Robert, and to share it with everybody who's watching right now.